Alright, so we're getting ready to start Mona's microneedling with platelet-rich plasma treatment. It's really one of my favorite treatments, to be honest, because it's good for all skin types, all skin tones, and practically every skin concern. You can do microneedling without plasma, but we find that when we combine these two things, the end result is so much better than just microneedling on its own. That's because this is really just creating little micro injuries, little micro channels, and the skin responds by building more collagen, building more elastin, and just really strengthening and thickening the skin. So whether it's pigmentation, acne scars, fine lines and wrinkles, enlarged pores, rough texture, the microneedling treats everything. And then when we combine microneedling with the healing properties of plasma, we get really incredible results. And what I've noticed in the recent years of me doing aesthetics is that people are really slowly starting to move away from injectables like Botox and fillers like Juvederm in lieu of more natural treatments. So it's really cool that we can harness the power of plasma and use it in facial treatments to really improve the skin. And there's no lights, no lasers involved in this, so every skin tone can be treated. And that's one of the best things because most lasers make you be very mindful of people with darker skin tones or a lot of pigmentation because they can actually get hyperpigmentation from the treatment. Alright, so she's numb. I just cleaned off the right side of her face and we're going to get started with the actual treatment. Right now I'm just getting the device set up. This is a sterile one-time use tip that we're going to be using for Mona today.
So is the product in the pen, or do you roll it?
No, so I kind of use the plasma almost like a lubricant, like a serum, if you will. And I use it to help me glide the pen over the surface, which is essentially just infusing the skin with your own plasma.
So the plasma that was drawn on our blood, we're like kind of rubbing on our face.
Exactly,
That's cool.
Exactly. And that's why some people call this the vampire facial, because we're taking a component of your blood and using it on your face. As you can see, the skin pretty much starts turning red instantly. Certain areas of the face, you might see a little bit of bleeding, but we don't need the skin to bleed to know that we're getting an effective treatment. But we do want the skin to turn red so that we know that it is responding well. So I'll go over every area very thoroughly, doing like a cross-hatching pattern. And then before I move on to the next one, I'll just do circles, make sure that we didn't miss a single spot. And then before we move on, we just put a little bit of plasma on. And we just be generous with the plasma and really let it soak in there. Alright, so we're almost finished with her treatment today. As you can see, she's having a great response. What we're looking for is this nice even redness. She can expect this redness to last about 24 to 48 hours. It looks like a moderate to severe sunburn. Everyone kind of responds a little bit differently. Skin will be a little bit tender, but it's totally manageable. All she's going to do is keep her skin really well hydrated. I'm going to give her a hyaluronic acid serum that she can use. Drink lots of water. Eat some nice, healthy, nutrient-rich foods because you gotta remember your skin is trying to heal from the inside out. Yep. And of course, be sure to rest and stay out of the sun. And stay out of the sun. Yeah. Ideally, we want to avoid makeup and sunscreen for about 24 hours afterwards, just because those things can cause the skin to be a little bit sensitive, and that actually hurts the healing process. So the best thing that I tell all my patients is just stay inside. If you have to go outside, just wear a big hat and try to avoid any sun contact with your skin. Okay?
Yep.
Any questions for me?
No, I think you pretty much covered it all.
Perfect. So I'm going to finish with her nose, her upper lip, and her chin, and then she'll be good to go. Next treatment will be in 1 month. And then most patients will do 3 initial treatments, and then after that they just maintain the results with 1 treatment every 6 to 12 months.